Hi, I'm Ketan from Brightside Dental. Welcome to episode 26 of BSTV. I would say within the practice, one of the biggest frustrations, both for our patients and us as a practice, is waiting times for appointments. Sometimes it can be rather lengthy, and understandably that can create frustration. And I just wanted to discuss that a little bit and explain some of the reasons for that. So one of the biggest factors is that for patients who are seen under the NHS, the way the system works is that we have quotas from the government, so they allocate how much treatment we can carry out as a practice over the course of the year, and we have to spread those quotas out fairly evenly throughout the year on a monthly basis. So unfortunately, those allocations are limited, so we can only offer a limited number of appointments to patients on a monthly basis, which then does mean that often it can be a number of weeks waiting times for appointments. Now, this isn't a problem just within our practice. Many friends and colleagues that I know are in similar situations, and certainly outside of London and rural areas, there are many locations where either NHS dentistry is just not available at all, or the waiting times are many months rather than weeks. So unfortunately, it is becoming a bigger challenge, an issue, and it feels like dentistry is moving more towards how it is for hospital appointments, where generally there are significant waiting times. So as a practice, there are a number of things we do to try and help manage this, try and help minimize the waiting time. So one of them is that we send various reminders to our patients, so that will be by text message, email, phone call reminders as well. However, despite this, another thing that really adds to our waiting times is the number of missed appointments and late cancellations, and on average we lose about 40 to 50 hours per month on that, which is significant. Effectively, that's the equivalent of one room per week that becomes not used during that time. So what I would encourage is, firstly, please do make sure that we've got your correct contact details so we can be in touch with you. And if for any reason you're not able to make an appointment, please do let us know in advance so that we can offer that appointment to someone else. Other aspects are we do have a priority list for our patients. So if you're generally available to come at fairly short notice, you're quite flexible, definitely let us know, because where we get changes in appointments, then often we can bring appointments forward. Other things we do, as our regular patients will know and have seen, is that we've had ongoing refurbishment done within the practice over the years since I took over, and that it will continue, and there are further plans in place for this year as well. Along with that, we routinely invest in new equipment, technology, which helps us deliver better service and dental treatment, as well as improving our efficiency as well. Other areas are all our clinicians and nurses regularly attend training courses, both externally and in-house, to build on their skills, learn new skills as well, so that we can improve our offerings and the way we're working as well. Another thing I do want to discuss, which we're really excited about, and I think will have a big impact for our patients, is that we've recently introduced a new service within the practice. So one of our hygienists, Mihaela, is also a trained dental therapist. So she will now be providing additional treatments for patients, which include fillings, extractions for children. And by doing this will be another way we can reduce the waiting times for NHS appointments. The other area is, as a practice, we offer a full range of NHS as well as private treatment options. Now, I appreciate that for many people they may prefer to have NHS treatment or financially are not in a position to pay for their dental treatment. However, for those who wish to, we do offer a full range of private options as well, and there we have a wider range of treatment options, but also we don't have the limitations that I mentioned under the NHS, because we don't have quotas we have to work under, and also we can offer more flexibility, for example, with our appointments times, where we can offer evening appointments, Saturday appointments, where we don't have a contract for that under the NHS. So we aim to keep working on ways to keep improving, delivering better levels of service. If you do have any suggestions or ideas that could help with that, please do let us know, and then we'll see what we can do to help put those in place. Thanks for watching, and I'll see you next time for more tips and advice on improving and maintaining your oral health, as well as practice news.